Life is so fun when you're jacked. Okay. Life is fun when you're yoked. So
let's be real, that's true. That's true. 100% true.
You want to walk and you want to just, it's just fun as shit. And I'm 60 and I don't want ever to end.
I'm Dr. Thomas O'Connor, a lifelong powerlifter, board-certified physician, and published academic author. I've taken care of thousands of men on testosterone and steroids, and now I use my media appearances and this YouTube channel to provide education and harm reduction. Subscribe now so I can help you stay strong and healthy.
Biohacking on steroids plus even testosterone. Andrew DeCaro, my chief science officer and also my director of affiliate and global relations for Testosteronology. We wanted to bring this to you guys as we're always talking about how you could stay strong and healthy on androgens. And yes, I've been on testosterone plus some steroids for more than 35 years. I'm 60. How old are you?
36.
36. He's on TRT. So we want to be transparent. We want you guys to learn today how this can be possible. So first off, if you enjoy this channel, I want you to subscribe. If you know people that are either on testosterone or steroids and can benefit from this content, please share that this channel with them so they can subscribe and learn. I want to grow this channel, of course, guys. So here today, we're going to talk about the biohacking. It's March of 2025, and Andrew and I, working together and being friends for years, met in this space because he understands the value of keeping health, preventive health, before you have disease. Now, we're both, our love is the cardiac system,
100%,
and renal. So if you understand Newtonian physics, guys, if you understand oxidation, you're breathing oxygen, you're a mammal, you're living, you're getting older, telomeres changing, inflammation, disease, there's so many vector forces coming at us. So we've developed together. Now, Andrew's not a doctor, but he's brilliant in this world with me, and he's a scientific guy. And I've developed protocols caring for men that are on too much testosterone, which is called steroids, and now that world is coming to its own with harm reduction. And I want everyone to learn from this. So if you're on testosterone and or steroids, the basic physiology of oxidation and every action, there'll be equal and opposite reactions. So if you're on testosterone and steroids and you're loving the muscles, can it cause hypertension? Can it cause abnormalities in your cholesterol?
Absolutely.
Do you have plaque in the artery, the red blood cells, right? That androgen-induced erythrocytosis, not to mention prostate, right? So do you have prostate cancer? Testosterone and steroids, with the grace of God, doesn't cause prostate cancer. But if you have prostate cancer and you're in your 50s or older, even rarely younger, are you stimulating the growth of that malignancy in the prostate because of androgen, right? Testosterone, DHT, the whole rabbit hole. So let's go over my old school ABCDs, because that's what's going to be for you guys. So
ultimately, like our mission statement with TRT now becoming readily available and more men and women getting on TRT, we understand the risks and the dangers, and our goal is to keep men and women safe so they can do this effectively, so they can be healthy, they can be strong, and you could optimize your health span and your lifespan.
Quality of life.
Your quality of life. Because with great privilege comes great responsibility. And if you're going to use testosterone, TRT, and if people are going to use androgens, there's a great amount of work and knowledge that needs to be obtained in order to do them safely to prevent certain events from happening.
And guys, look at him. I mean, this guy is just jacked. We just walked, we're at a truck stop in the Anabolic Dock RV here. We met halfway, some undisclosed location in Florida. And we went inside, and people were just looking at us with their mouths were down because, like, who the hell are these guys?
Yeah.
Life is so fun when you're jacked. Okay, life is fun when you're yoked. So
Let's be real. That's true. That's
we're
true. 100%
walking around.
true.
You
100%
want to
true.
walk, and you want to just.
Yeah.
It's just fun as shit. And I'm 60, and I don't want ever to end.
How much can you bench press?
Well, with a shirt, I'm benching in the mid 400s right now. And I'm a crazy guy. Don't do that at home.
Yeah.
But I'm a power lifter, and it's equipped, right? So it's with the shirts. Hold on.
60 years old.
So guys, but we're giving this information because it's true. It's not bullshit, but there's a lot to do. So let's understand the basics. Thinking caps are on, ABCDs. We'll use myself as an example because I've done it before with my labs on this channel. Hemoglobin A1C. No one's going to argue, from doctors to bro science guys to anyone in this space, even selling supplements appropriately, right? Some people are inappropriate, but there's some great supplements. If you look at glycemic index, and if you look at America and obesity, and anywhere obesity, everyone's going to agree non-optimal glycemic life in a mammal and a human is going to destroy your brain, your heart,
Yeah, absolutely.
your organs, your kidney, diabetes, right? Pre-diabetes.
Yeah.
So I stay as lean as I can, but I'm not perfect. I have food, and I can't starve myself, and I've tried, and I don't drink wine anymore, guys, but I do on most nights will enjoy a little shot or two of a nice single malt, maybe a blended whiskey, because that's what I like. Be careful with the alcohol. So, but with everything said, at my age, with my genetics, with my diet, with my weight, with everything, my A1C would be near pre-diabetic. I was like, no, it ain't. So I take metformin. You don't take metformin, do you?
I don't take metformin.
You're young.
No, my A1C is always like 5.0, sometimes less. My fasted blood glucose is usually in the 60s, maybe the 70s. That's just about it. I want to differentiate when he's talking about blood sugars and we talk about diabetes, he's mainly talking about type 2 diabetes, which is part genetic, part self-inflicted. Type 1 would be autoimmune.
It's all type.
Yeah.
It's all type 2, right?
Oh yeah.
It's impaired fasting glucose, and its insulin becomes desensitized as you get older. With America, with the bad food, I'm against the bad food, guys. Right? I mean, I'm against the bad food. It's always diet and exercise. But when you do the most you can, and if you like biohacking and technology, I don't want to be a pill pusher, but I need to give this truth out to you guys. Do the best you can with diet and exercise. Then we have biohacking, biotechnology.
So I will actually say, I do use Berberine, which is like a mild, it's like a mild form.
Right.
You know.
Absolutely.
Yeah. Metformin, a little background. It's been around since, the Egyptian times. It's derived from the French lilac plant, and it actually has really strong natural origins. It was first launched as Glumeta. Right. It's a and glucophage. It's a highly effective insulin sparing agent.
Right.
Yeah.
Sensitizer. It's got other properties.
Sensitizing agent. Yeah, many properties.
For most people, it's incredibly effective when you're pre-diabetic, really pre-diabetic, or even you've just crossed the line into real type 2 diabetes. Now, that's still standard of care for internal medicine and for diabeticologists and endocrinology. Now, the GLP agonist, they're there too, but I'm going to put them on the side.
Yeah.
I tried them, and man, for me, they were rough. But for you, they may be a miracle. Let's move on for time. So B is blood pressure. Guys, you've seen the videos that I've done with Andrew on my own for years. Telmisartan is a beautiful drug that not only protects most men from the ravages of hypertension on your brain.
Yeah.
I think of the stroke, I think carotid arteries, but there's plaque too. The heart, the kidneys, and the erections. And again, that's head to toe. And this medicine actually is something that we call repurposed for the fact that if you're on enough of it, which is at least 20 to maybe 40 milligrams, max dose is 80 of telmisartan, and if you could tolerate it, and don't just start with the max dose. So it can slow down the red blood cell production, which is called androgen-induced erythrocytosis. Now, the next piece of the blood pressure is we both love to add little doses or not so little doses of Nebivolol. Guys, that synergy
for both of us. So the reason why this synergy is so effective. So when he talked about telmisartan, yes, there are other blood pressure lowering modalities. There are like ACE inhibitors. There are other ARBs. But what really makes telmisartan shine is that it has effect on the PPAR gamma system, okay, which directly affects the left ventricle, which actually improves the metabolic rate, but also it has a 24-hour blockade of the renin-angiotensin-aldosterone system. And when we have excess testosterone, when men and women use androgens, we produce more renin from our kidneys, and this causes vasoconstriction. This is what leads to high blood pressure, left ventricular hypertrophy, and intravascular edema. Yes, and we block this from happening with telmisartan, and we can do it from a 24-hour perspective. Go ahead. So we want to keep moving here for you guys. I want to keep you on the seat of your chair. Yeah. So you keep your doses of testosterone as low as you can, guys. If you're adding other drugs, with the grace of God, steroids that can be great to add, like DHT-derived drugs. I'm not giving a blessing on it. I don't do this in my medical practice, but if the future's here and the now, in the future, small doses on training days and low doses of Anavar, synergistic, be very careful. But when you look at your blood pressure, it increases blood pressure for many of us. Yeah. What are you doing about that? So from an organic standpoint, don't do it with those drugs and lose weight. Don't eat garbage, sodium and carbohydrates. I'm making all the coaches proud. It's true. But if you're a little hypertensive and you want to live like me, I'm walking proof for decades that my echo with the grace of God and my heart's perfect with the grace of God. Go ahead. Well, I mean, one of the things to even more corroborate what he's saying is, we're seeing lots of young men nowadays with heart failure and reduced ejection fractions, heart's reduced ability to pump effectively. We actually did a YouTube video where we discussed heart failure, unfortunately, in a 30-year-old pro bodybuilder. But one of the other medicines we use is Nebivolol, and what separates Nebivolol from the other beta blockers that are around is it's a cardioselective beta blocker. It stimulates only the beta-1 receptors, which are on the heart. And it also has a nitric oxide producing properties, not nitric oxide coming, exactly. Not nitric oxide coming from like a pre-workout drink, but the endothelium producing nitric oxide on its own, further protecting it, even a more protective effect. And so now you're making the heart not have to work as hard, so the heart isn't like a state of Shangri-La. So it's relaxed. Did you know that we compete against each other with vital signs all day long? Yes. Look at my blood pressure. Can you beat that blood pressure? I want you guys to take this challenge. Because when I first, years ago, before I knew him, I thought I was the one who was like, this is perfect. I got my vitalized. I figured out the biohacks, and then I come across O'Connor, and I was like, I'll be damned. Okay. I want you guys to join us. Yes. Join us. Yes. Especially on the app. This is Testosteronology optimizing health span and lifespan. Okay. Let's move on. So let's go to D. Let's go to C. Let's move to C. So C stands for cardiac disease, cardiology, echocardiography, calcium score. So I had some plaque in the artery based on a calcium score CT angiography that I did probably 2006, and it got worse over time. And then you guys may know on the videos I've done here with Dr. Nolan that I delipified by 20%, hard plaque, which is freakish. And I did it because I did my A, guys, I did my B, we just talked about, and the C is tricky because not everyone's cholesterol is going to lead to coronary artery disease. But it was when you have coronary artery disease, get a calcium score. That's easy to do around 30, okay? It's not a CT angio with IV contrast dye, and it's not too much radiation. So when you can look at that, it gives you an idea of, do you have hard plaque, atherosclerosis starting, and you're young and it's completely silent. I saw it and I started my statins, and I was like, I don't like these statins so much, but they are good to some degree, and I wanted to slow down the train. Then I started, probably 7 years ago, PCSK9 Repatha. Those two combinations, then I added, what did I add? Ezetimibe, yeah. Ezetimibe. So guys, my LDL, I keep it less because I had plaque. I have technically
arterial disease, and my LAD, the widowmaker, which is where most men have it, it's just absolutely freakish, and it's just ominous that I was able to pull that plaque out from a hard scale, not soft. I have no soft plaque. There's no way. Whatever soft plaque I have is hardened, okay, and stabilized because of what I do, because of this therapeutic medication, ABC, especially the C. A little statin, but I take 10 milligrams every other day of rosuvastatin, take 140 every 2 weeks of rosuvastatin, and 10 milligrams a day of azestamib.
Correct.
So now my LDL at baseline is 130, 140 when I'm just eating my regular, with my genes and all my everything in my life. My LDL is sub 50 milligrams per deciliter. Now, this is not your goal unless you have plaque. Everyone has their own goal. So, but I want to talk about this because I want to close, because I want this to be a tight video.
I got to comment on this.
He's going to comment.
Yeah, because so look, the atherosclerotic process is a lifelong process that begins the moment you are born. Okay, so like, as much as I love him, you don't ever want to be in a situation where you have to remodel or delipify plaque, because it is extremely, extremely difficult. Some cardiologists will argue that it's impossible. Okay, so I believe in order to prevent this from happening, if you're on androgens or testosterone, you could cause classic dyslipidemia, high levels of LDL, low levels of HDL, and so forth, which you don't want. We want to get the LDL, bold statement, as low as you can. The sooner the better, and the longer the better, and the faster the better. Okay.
And we can go into supplements.
Dr. Al, that's for you. So,
okay.
Yeah.
So, again, and diet and exercise and understanding your genetics and family history, and then getting an anatomical diagnosis with technology now, CT scan, with I think, just if you have no symptoms and you don't have heart disease and you're not a high risk, if you're in your 30s or older, 40s, 50s, and you're asymptomatic, a coronary artery calcium score is brilliant, and the American College of Cardiology, American Heart Association actually recommend it if you're not sure that you should lower your cholesterol, or you have risks that you're not really sure you're at risk. And then if you start seeing you have plaque in the artery, you're a done deal. You got to be aggressive.
Yeah.
That's my modalities. I've been doing this for at least 10 years. And I'm an internal medicine doctor, and I know the data. Now, the last piece I want to close on is these medicines. Now we have sodium glucose co-transporters, Jardiance and Farxiga.
Yeah.
They listen to this, guys. I'm probably going to start Jardiance pretty soon. Okay. Now, my echo is stable. I've been on steroids and testosterone. I bench heavy. My echo, with the grace of God, my EF is 55%. It's okay. I do not have a low EF. Low is less than 50. Okay, even 50 is kind of borderline. However, we argue this, and he's not a cardiologist, but he works with cardiologists, and he knows cardiologists, and I know them too. So I don't want it to go lower, but I know the physiology and the pathophysiology of as I'm getting older.
Yeah.
And with all the pressure when I'm lifting, because I still like to bench heavy, and I don't otherwise smoke. I don't excessively drink, but I love my little shot every night or two. And could that hurt the heart? And then I am on testosterone. I like to add some baby doses of NPP, or even Masteron baby doses. Now, is it going to hurt my heart over the next 40 years? Because I want, with the grace of God, to live a quality life to 100 or more.
Yeah.
So I'm going to start Jardiance because I can't believe the effects on the preload, the afterload, on the myocardial tissue. And I've seen patients with heart failure remodel and come back so quick.
From like 12. From like 12.
Low ejection fractions that are low. And of course they stop this testosterone. They stop the steroids, super physiologic.
So we think.
Well, but they stay on some testosterone.
Yeah.
And these medicines, in the old day, it was just like, get off everything. They would say, get off testosterone. I would say, you got to stay on a little testosterone because you're going to have no life left.
Yeah.
We're not talking steroids, doctor. And the doctors have all agreed with me. I'm like, a little testosterone. The guy's shut down. He has anabolic steroid-induced hypogonadism. So, again, be careful. This is man per man. But in the end, if you want to play with a little bit, I thought this is a vector force. And the new vector force potential to mitigate is the sodium glucose co-transporter before if you have a low normal ejection fraction.
But let me just add really quick.
We don't know. Again, we don't know. But this This is the now and the biohacking future.
Nobody go on any of these medications without your doctor
Right.
or a licensed testosteronologist
Right.
assisting you.
Right. This is educational. And again, this is giving information to you guys, but this is what's in my chemical milieu. Mine. Thank you so much. Guys.
Awesome.
So let's see some cool
Healthy
comments.
and strong.